All right. Hello, everyone. My name is Mildred, and I am both the developer for this project and the consultant for the case-based surveillance system. Today, we are going to look at the case that will cover pediatric and explosive fat, and then we are going to look at the offline templates that we use to collect screening information. Some of you had different practice and different questions during your practice or your screenings. And so we'll address some of those questions now, and we will go further. All right. So one of the things we noted is that if you screen or you do your screenings for antenatal clients outside of the antenatal system, it is not going to reflect on the antenatal card. So when someone is pregnant, we have said that you don't use the HIV, TB, and syphilis tabs. You just go straight to the pregnancy registration and use the antenatal or follow-up tab to record any screenings done during that pregnancy. So let's look at this. So we have a client. Let me get a unique ID. So we have this client who has an antenatal account. And once we want to screen throughout this pregnancy, and it is an antenatal screening, you don't use this HIV screening tab, TB or syphilis. While this will be recorded, it is not going to reflect on the antenatal. You use the screenings for pregnancy HIV screening, and you record the screenings there for you to find the screening. Also for syphilis screening, for TB, and for hepatitis screening. If there are other routine screenings, you also record them here. Once the pregnancy is done and screenings are not part of antenatal or postnatal, then you can resume using all of these other tabs for recording of all of the screenings. This way, the antenatal record is going to have the screenings that are done for antenatal follow-up, and it can generate flags based on when the client was screened and the gestational age of the pregnancy at the time the client was screened. Okay. So does anyone have questions from the practice before we start something new? Okay, so I assume that everyone understands what we've done so far. So we have an offline template that doesn't display for users, but the administrator has access to those templates to both download and upload the template back. And we did this structure for better control and so that there is no wrong record on the system. When there is a need to use an offline template to record screenings, the supervisor is going to send you a spreadsheet, and that spreadsheet is just going to be an Excel spreadsheet that looks like this. Once you get this spreadsheet, it means that when you go for outreach, you can fill in information without internet access. You are to focus on the first sheet, client batch upload. All of the other sheets here are just for control, and you are not supposed to alter them. They control the drop-down menus that you have on your sheet. If you alter any of these sheets, the system will reject this spreadsheet when you send it back to the supervisor. So it has the same information you fill in when you are creating an account and when you collect information. All of the information of the clients, the personal information, the risk behaviors, and the comorbid information will all be collected on this sheet along with the screening results. And so let's fill one so we can see how it's filled. You put in the serial number and the unique ID of the client. If the client has an account on the system, you put in their unique ID they have on the system. If not, you put in a new unique ID that they have based on whatever unique ID you use within the country. So let me put a unique ID here, and then the testing site, you select this testing site from the list of sites on the drop-down menu, and the facility type, let's say this is outreach, the first name. So if you're not collecting names, you must put the first letter of first name at least. So let's say this person's name is Elijah, and the middle name is not known, and the person has a last name, let's say David. The mother's maiden name is unknown, we put unknown, and then the sex of Elijah is male. The date of birth of Elijah is, let's say, 30th, and the month of birth is, let's say, June. The year of birth of Elijah is, let's say, 1989. Country of birth now, let's say Grenada. Country of residence, let's say Grenada. Address in the country of residence, the health district, you select your health district from the list, the parish, the marital status, the occupation, the sexual orientation, the gender identity, the ethnicity, the education level, number of sexual partners. If the client has oral sex, you select oral, and vaginal sex, and anal sex. If not, you leave it blank. Diabetic, let's say no. High blood pressure. Alcoholism, let's say no. Malnutrition, no. Renal disease, lymphoma, chronic lung disease. Test modality, test 1, we want to do HIV rapid test. The test kit is, let's say we use Unigold, and the result is, let's say, reactive. The test result date, today's date, let's say the day is 17th, the month is October 10, and the year is 2024. Let's say there's a second test, let's use test kit, the test result, and let's say the day and the year. The title, if the type of test was a syphilis screening, then they had sex with males, let's say he says never. With females, let's say in the last 12 months. I'll randomly just answer anything here. So we can see that all of these everything we navigate through several forms on the system, and you can use the spreadsheets. For those who are like data entry clerks here, you can use the spreadsheets to simplify the first step, which is create the account, put all the initial screening results and upload into the system, and then you just start doing from the referrals down on the system. So if you go for outreach, the major thing you do is just to collect risk behaviors, the person's personal information, and the screening results. Risk behaviors are very important for reporting. If you don't have the risk behaviors, then the data on the system is as useless as not even collecting any data at all. So we need to make sure that we get the personal information. At the very least, we want to know the biological sex and the year of birth for the personal information, and the country of residence. Then for the risk behaviors, we want to know everything about their risks that are asked there. The comorbid information, you have to fill them in if they're available, and the test information has to be there. So these are required things that we have to try to make sure that when we collect data, we collect meaningful data that are actually useful, and not just filling the form for the sake of filling it without having anything meaningful out of it. Okay, so once you fill this, your supervisor will tell you how many number of clients they want on the sheet. You can put thousands of it if you want, but for better control or to be able to spot errors faster, it's always better to limit the number on one sheet. Maybe you want to say you want 20, 50, or 100 screenings on one sheet, so that when you upload and it tells you line 14, you'll know that this is where the error is. This person's name wasn't filled in, and then you know that part was not uploaded, but every other one was uploaded. Then you know how to correct it, or for who sent the sheet, and your supervisor gives you a call about that particular entry error. So you want to put as few as possible on one sheet so that it is easy to trace and easy to get things. Okay, once you are done, you either send this spreadsheet as an Excel spreadsheet and the supervisor will convert to CSV file before upload, or you go to file, you save as, and make sure that you save this file as CSV UTF-8. Although the system downloads this as an Excel spreadsheet, it does not accept the Excel back. It accepts only CSV files. And the thing is, Excel has binary files, and that saves everything about the workbooks, the formatting on the page. CSV files are just plain text that just focuses on the value, and the system wants just the values to know where to place them on the system. Also, you can do your screening on the spreadsheet, upload it on the system. You send it to the supervisor to upload. Screenings and management rule does not have the link to upload, and we do this just to control errors, because it can happen that you are in a hurry, you want to get the job done, you put 50 on the sheet, you get 3 errors on 3 lines, you don't report it, you just keep it and move on, and then we'll have a lot of errors on the system. And so we want a supervisor who is already trained to make sure that all the important records are collected, to verify the sheet before it is uploaded on the system. So the sheet is straightforward. It's just for you to fill it in. If you don't know how to convert to CSV file, just save the sheet and send it back to the supervisor, and ensure that it is uploaded within the same week so that you can continue your data entry for the same client. If it's a data entry clerk and you're trying to just gather all of the account information for all the clients for when they were positive, you can use this to batch upload a lot of clients at once, and then go back to the system to start doing the referrals for all of those who are positive, and then continue with the system to fill in clinical records. Does anyone have any question?
Just for reiteration, Mildred, so when you open your device and you're out in your outreach, just show us again where you pull out the sheet from.
Okay, so the sheets is what you will send as a supervisor to everybody going on outreach, right? And you find the sheets on your administrator dashboard. So I'll log in as an administrator, and then you look at upload offline data and upload screening template. Here you click to download the template from the system, and once it's done and converted to CSV, you upload the template here back to the system. So for the one we have filled, let's just try to upload. So we'll just have one record here. Let's put a second one that we want to work with, and let's see how this works. We have a scenario in case 3. If you go to page 196 of the manual, you have a case about Dorothy. This case is about a pregnant female who just showed up for antenatal when she had the gestation age of 38 weeks and 5 days. And this case leads us to create 3 accounts. Well, let's skip this because it is going to be long. Let me just make up a case here, and let's use this to illustrate. Okay, so I just copy this. I'll change the unique ID, and let's change the name, female, and let's say Princess was born on the 20th of April in 2021. Let's say Princess is single, Princess is not applicable, sexual orientation is not applicable, the gender identity is not applicable, For instance, highest level of education is not applicable. Number of sexual partners is not applicable. 0. And this will be blank. This will be blank. High blood pressure, no. Alcoholism. Malnutrition. Renal disease. Lymphoma. No disease, no. Lymphoma, no. Okay, so let's use this as the 2 records that we have. And for me to upload this, I will save as, and I'll save this as CSV UTF-8. And then I will save it in my download there. So I'll say, okay, I have this saved. When I come back here, I want to upload this. Now, the upload is very sensitive. We want to watch out for error messages. You want to make sure that all you see are blue banners of messages. You don't see anything out of the blue banner. You don't see any cryptic messages. If you see one, if you can't interpret it, you can take a screenshot and send it to me or send it to the IT support if it is after the evaluation period of the system, and they will know exactly what it is based on the error manual that they have. I'm going to choose here to upload the file. Make sure the extension is .csv.
Mildred?
Yeah?
Sorry, I didn't see how you got to that page. How you got to that page?
So this is the administrator's page. I logged in with with a user with the administration permission, administration role, and then come to upload offline data and this. I will even suggest that supervisors try to make every site have their own supervisor that has this account. So you don't, or more than one supervisor. So you don't have to, you are screening and you don't have to wait for just one person at a different site to respond to you. If you have somebody within the site or within the group. So for instance, you're going for outreach, there are 10 of you. The supervisor can train one person to be that supervisor on the field that can have this access to accounts to do things. So you don't have to be calling or waiting on someone. Maybe your supervisor is in a different meeting or cannot come to the phone or attend to the emails at the time you really need it. So all of these are things that within countries, supervisors have to decide how to make things easier for everyone. So when we choose file, we make sure we select the file we just converted to CSV, click on upload record and pray for everything to be blue. When it's blue and you don't have any error message at the end, you scroll to the end, you are fine, you are safe, you are happy, you can shut down, you can go and sleep, you can drink a bottle of wine, you've done everything correctly. If you see any message outside of a blue banner, you should be very worried about your data and you should call whoever is supposed to be support with a screenshot of the error message to be able to tell you what line number or what rule information is not correct. Okay, so you are not going to be able to upload the training workshop for administrators that we did previously already covered this, and so all supervisors already know what to do with this. So for you users, your own focus will be on just entering the records on every field and try to get as much information that you already have, and everything is required on those fields, okay, on the spreadsheet. So now we have this uploaded. I want to see the unique ID. Let's take this unique ID and let's go to the system now to see how these records were inserted where it's supposed to be. So I'll log in as someone with the screenings and management permission. So you want to try to ensure that your supervisor uploads these things as soon as you send them, because if in the event you want to batch upload them so you can find the record on the system, so that you are able to continue from the system from referrals, then the supervisor might delay you if they don't get that done as soon as possible, or they delay for 2 weeks, 3 weeks, then it stops your work until that record is on the system. So now we want to come to request release of client file. When a spreadsheet is uploaded, you don't need to create an account. Whether the account existed previously or not, as long as there is a unique ID there, you request release with that unique ID on the spreadsheet. And we put a unique ID from the spreadsheet, and we want to We just want to see if this is actually on the system and if the records are where they are supposed to be. And now we come to collect information and we enter that. So now we can see that this client is 3 years old. The date of birth was 2021. We can see the risk behaviors. I didn't change some of the risk summary. Was supposed to be no for a child. I just copied and pasted from the first one. And we can see all the information we filled in the spreadsheet on the system. So it makes it faster than navigating through everything that we have. So you can come here to see if any of these things are applicable to the client. You now fill them in. Any information that is missing that the spreadsheet doesn't cover. So here we can see that everything we need from this child who is 3 years old is filled in. So we don't really need to fill in anything else apart from if we want to change if the client is alive or dead. The client is alive and the cause of death will be not applicable. And most of these things will not pertain to a child as much. Now, the answers to the risk behaviors that we have will populate here for risk behaviors that are of high risk. And then when we look at the risk behavior, we'll see the previously filled risk behaviors. We can update them since I copied and pasted that of an adult here. And this does not reflect a child's account, but this is for practice. Then the comorbid information was filled in also from the spreadsheet. And then let's look at the HIV screening. And the HIV screening was also filled in. And the TB screening wasn't done. Syphilis was not done. Other screening still has the HIV, second HIV that confirmed positive. And then now we can come here to list contacts if it's where the child had something that the household contact might be at risk, but for the child there's nothing to list contacts. You can come here to put in the vaccination history if there's a vaccination card for the child. And then we can come to referrals now to now refer new HIV case. Now you can see the spreadsheet already did most of the work before referral. Does anyone have questions about it? Lester, are most of your questions answered?
Yeah, but I think most people maybe would go for this spreadsheet.
Okay, the spreadsheet looks faster?
A lot, yeah, much faster.
Yes, so we can actually...
that we entered everything correctly.
Yeah, so what we can do is next week's training, 23rd and 24th, the last 2 days, where we'll do see the surveillance reports. 23rd, we can all do batch spreadsheets and try your hands on uploading to make sure that, okay, that you're comfortable with that. And then 25th, we'll look at all the surveillance reports that are generated from everything that we have entered. So you can tell your other colleagues that I think it's 23rd and 24th are the last 2 days for end user training. And those days are the days where we'll finalize all that we have looked at and see the effect of the data collection on our reporting and how the system automatically generates reports from what we have entered and how our report fails when we don't enter what we are supposed to enter, so we can see the impact of what we do on surveillance of the system. So any other person has any comments or questions or query about this?
So we work with the physical spreadsheet out into the field?
Yes, sir?
And then upload it? Do we work with a physical spreadsheet into the field to collect the information?
Yes. No, not physical spreadsheet. It has to be on your tablet or device, the spreadsheet.
Okay, so it's not like a form that is downloaded. The spreadsheet is not downloaded and we use it.
So the thing is, if you print it out and you fill it on the field, you need to now enter it on the spreadsheet and soft copy, because the soft copy you have to upload.
That is what I was asking.
Yeah.
I am just wondering, this is to the person that now asked the question there. I'm wondering if she have two devices open at the same time, maybe she phone and the laptop, because you're hearing a lot of echo.
Okay.
No. Just the laptop.
Okay.
Okay. All right. Okay, so anyone has questions about the spreadsheet, if you feel this is the best way to go to easily enter batch record. For my own trial, it's easier, but then I'm the one who created it and I'm the wrong person to give an evaluation on it. But so I think we'll put it out there for you to try yourself and you decide which is faster, and between the countries and supervisors, you decide if you just want to constantly use spreadsheet for the first set of uploads and then continue from referral outside of the spreadsheet. So for that client that was confirmed positive, this is a pediatric client. So for you to practice, you can come to this site for now during the training, cbs5.mildredgroup.com. After the training workshop, your supervisor will give you an account on your training site within the countries. Every country has a live site and a training site. The training site will be given to you to practice and enter wrong records or to get familiar with it, but the live site is a site that you only enter real records, no practice on the live site. So, sorry, I was answering the question on the chat. So this is October 2024, and we put in the unique ID from the sheet, and this person is pediatric because the person is 3 years old, and then we refer. Referral successful. So it is at this point now that the care registration and initial evaluation for the pediatric client starts. Now we can view HIV care referrals, and then we will see the referral of this client, pediatric, and the name is Princess John. So for us to continue with this case, I want to read a case that will guide us on this process. So let me get a case. So yes, let's look at case 3, which is on page 196 of the manual. The manual will be updated, so I will advise you not to print it, as many things are not on the manual. This is the manual from 2022. The new manual will be out after the workshop. Dorothy is a 28-year-old female, gravida 2, para 1, of gestational age 38 weeks and 5 days duration. Present for antenatal for the first time. Her daughter Princess is a 3.5-year-old girl whose mother has been brought in for an HIV test because of fear that her child could be HIV infected. Such fear stems from the fact that Dorothy was diagnosed with HIV infection on another island 4 years ago, but never came in for treatment, nor did she receive antenatal care during this current pregnancy. Princess is not developing like other children her age. She has recently lost a bit of weight and has recurrent respiratory tract infections, intermittent fever, skin rash, and swollen lymph glands, which has been more frequent over the past 6 months. Dorothy fears that her daughter Princess might be HIV positive and is even more concerned for her unborn child. She cannot live any longer in denial and wants to be retested for HIV and have Princess tested. On assessment by the midwife, Dorothy was 2 cm dilated. She was asked to check into the maternity unit at the hospital. Both Dorothy and Princess were confirmed HIV positive and immediately referred for care registration and management. A few hours later, Dorothy arrived at the hospital where her labor progressed rapidly. Jason was born weighing 5.5 pounds, 45 cm length, head circumference of 33 and chest circumference of 32 cm. We have a lab result for Dorothy suggesting that she also has bacterial vaginosis, and in addition, she was VDRL and TPHA reactive with a titer of 164. Both Princess and Dorothy were confirmed HIV positive, and so we'll do that, and we have the clinical management scenario for the same cases. So we have 3 cases in one: Dorothy, the new exposed infant Jason, and Princess, the other pediatric child that was born. So on the spreadsheet, we already created an account for a pediatric who fits the age 3.5 years old and was confirmed positive. We are later going to look at Dorothy's case, create an antenatal account, and then we are going to register Jason into exposed infant care. Okay. So the first thing is to have that account created. So I'm going to look here, and we already have a case for Princess. So let's work with Princess first, and then we'll go back to do the mom and the exposed infant. So this Princess has been referred for care registration and management. We have the unique ID. We want to come back here and now go to care registration and initial evaluation and look for HIV care registration, adolescent, adult, pediatric here, and then we put in the unique ID, get registration form, and register into care. Then on successful registration, we wait for the page to redirect, and we will now come back here to look for pediatric initial and clinical evaluation. Now we need to take note of the category of the client. If the client is an adult, you go to pediatric, you won't find an initial evaluation form. If the client is an exposed infant, you go to pediatric, you will not find an initial evaluation form. You need to get the form for the category of the client. So this client was referred as pediatric, was registered as pediatric, and then you come here to put in that unique ID and get the form. So the initial evaluation form for a pediatric client is totally different from an adult and totally different from exposed infants. This collects information about the maternal treatments during pregnancy, the intrapartum PMTCT treatments, the neonatal PMTCT ARV exposure, the current age of the child, and other information about the caregiver and the mode of transmission, if positive for the child, the mode of delivery, the gestational age at birth, things about the labor, the duration of membrane rupture, and also the date of final HIV diagnosis and the type of test that was done, the date of enrollment into care, and the dates that the ARV was started, and the dates that the child was aware of the HIV positive status, and the status of both mother and father, if they're alive or dead, and their HIV positive status. So the initial evaluation form for pediatric, let's fill this in. This child had no exposure during pregnancy and during before now, and the child is 3 years at enrollment. The name of primary caregiver is Dorothy. The type is family, let's say biological parents. The name of secondary caregiver, none. The type of secondary caregiver, we don't have. We have did the caregiver agree to home visit? We'll say no. The telephone number of caregiver, let's see. The mode of transmission, if positive, is mother to child transmission. Mode of delivery was vaginal. The gestation age at delivery. We have the scenario gave us certain things about princess delivery. When she was born, she weighed 6 pounds 5 ounces. She is not breastfed. Immunizations are up to date except for BCG. She remained in neonatal unit for 1 week due to respiratory insufficiencies. The health center has always treated her for recurrent respiratory tract infections. Medication history is just multivitamins and no known allergies. Social history, she lives with mother, attends preschool, mild developmental delay at 3-year assessment. She has no surgical history. Okay. So we have that, and she was born at, they didn't give us the gestation age at birth or the duration of membrane rupture. The date of final HIV diagnosis is today, October 2024, and the type of test was an antibody test. Oh, was it an antibody antigen? Rapid test is an antigen test, right? The lab people here.
Both.
Oh, it's both? All right, antibody. Date of enrollment into care today. And then date started ARV not yet. And the mother is alive. The father's HIV positive status is unknown. Address of father is unknown. And then the telephone number of father is unknown. And then we'll try to save this. Hopefully it takes our values successful. Then the clinical staging of the child. The scenario told us that this child is at clinical stage 3. Let's look at the scenario. Yes, HIV plus stage 3. So the stage 3 diagnosis is today. And then we save this. And then immunizations. They say she had all apart from BCG. For the sake of time, we will not bother filling this, but you assume that you have her immunization records on card, and you can fill in all of the vaccines that she has taken. Normally, the card will have the dates, the manufacturer and batch number of the vaccine that was given, and the place or where the vaccine was given. The place is automatically stamped with the name of the site that the person who is filling is assigned. So you can always change this. This is just to make it very fast. Most of the time it's not going to be who vaccinated the person and the site, but it's like this because sometimes you want to record immunizations while the child is at the clinic, and then it already puts your name and everything here. But this is what you can edit if you are filling in from a card. The viral load of the child was given in the scenario. Let's get that. Viral load is 2,000 copies per minute.
Mildred, sorry. Good morning. Sorry.
Good morning.
I'm Destiny here. For the vaccines,
Yeah.
Can it be a drop down?
The vaccines?
Yeah.
Yeah, it's a drop down of all the vaccines that are listed by the administrator during configuration.
Oh, okay.
So you just select whatever vaccine was given, and then you fill in the other parts.
Okay, thanks.
Yeah. So the viral load was, let's say the date is today, and the viral load test was done today. Let's assume that things are fast. The result came out immediately. And the 2,000 copies per mil. It should be higher than that based on the scenario. 20,000, sorry. Okay. And then the CD4 in the scenario was 330 cells per. So let's put that. The dates of first CD4 today. And we'll put 17th of October 2024. The value is 330 or 18%. Or we put 18%. And less than 350 is today. And then we submit. So we have done the initial evaluation for Princess, and we want to now go to psychosocial support part of it for the caregiver, and also do the clinical management. So once this is done, depending on the process within the country, you want to do your psychosocial and adherence counseling. Most of the time for a child is always for the caregiver that will answer most of the question. And so let's get an appointment for the unique ID, and we want to get an appointment for adherence readiness assessment. And then we come back there to start counseling encounter. So it gives us the form, and we'll answer the questions that are related to the child. How many sessions of retreatment counseling do the clients attend? We'll say 1. Is the client's treatment literacy sufficient? Now we are asking the caregiver. So say yes. Does the client have misconceptions about ARV? Let's say yes. And the misconception is she thinks ARV is like chemo. So did the client disclose his or her status? We'll say no. Is this person supportive? Not applicable. Has the partner been tested for HIV? Not applicable. Is the partner taking ART? Not applicable. Does client have children? This is also not applicable. Does the client have a treatment assistant? Let's say yes, and this is mother. Did the client's treatment assistant take part in pre-treatment adherence sessions? Let's say yes. Does the client wish to be visited at home? We said yes, and the location. Let's just give any description. How will you describe the client's mental state? Let's say depressed. Does the client fear discrimination or violence at home or in the community? Yes. Who does the client go to for support at home or in the community? Nobody. Does the client come to clinic or on his or appointment dates? Let's say not applicable. This is the first time. Has the client been adherent to other medications in the past? We'll say no. Did you plan a drug timetable with the client? We'll say no. Is the client a member of a care and support group? No. Substance addiction, no, unknown. We have, does the client feel confident about taking or giving children medicines every day for the rest of life? We say no. Who else takes care of the child other than the caregiver present? Nobody. Has caregiver been trained? Not applicable. Has client had any challenges taking other medicines? Yes. Does client know the names of the ARV to be taken? No. Does client know the side effects of these ARVs? No. Does the client know the consequence of not taking ARVs every day for the rest of life? Yes. Is the client on other medications other than the one prescribed by the doctor? Yes. Assessment of client readiness to start ART. Patient requires more preparation and counseling. Client's questions and concerns, you type them in if any. Other issues and notes, put it here. Let's say other issues. Client doesn't seem ready to be. Doesn't seem ready for adherence. Adherence strategy work plan needed. So we'll do this. And then we save. So you want to get this client ready for adherence. And so we'll book another appointment for this client, but this time for adherence strategy work plan. So what we want to do for the adherence strategy work plan is to put the client on medication and multivitamins, vitamin C, anything that is like a nutrition supplement, but at the same dosing as the intended ARV, to see how the client can be adherent to those trial simulation. So the adherence strategy work plan form is different from that for the pre-treatment adherence counseling. So the type of therapy you choose depends on, is now what creates the type of form that you are going to see when you start the counseling encounter. So now, because we wanted an adherence strategy work plan, we have no HIV basic seminar, so we say no. Recommend attendance at an adherence basic seminar, no. And we say none because there is none available. If there is, you put yes or no. Discuss patient preferred adherence strategy. Let's say self-managed adherence. Conduct a 1 week or 2 week practice trial to simulate the commitment and attention needed for ARV medication. Let's say we use nutritional supplements, and enter the medication you give and the frequency here. So we want to say, let's say vitamin B12. So put B12, let's say once daily. Normally, let's even say the ARV she's going to take is at this dosing, for instance, and we want to do it for 2 weeks. Just write anything here, and is the client ready to start medication? We'll reassess at a later date, and then you save. So if the client is supposed to come back in the next 1 week or 2 weeks, this time you'll do the pre-treatment adherence counseling again and see if the client is ready to start ART. So in the event that the client actually started ART, you'll book another appointment for the next time the client comes, and this time this appointment is going to be for adherence follow-up assessment. When you start this counseling encounter, the form you will see for adherence follow-up assessment is totally different. It only looks at the medications that was prescribed to the client, and if the client missed any dose, forgot it to take any, and then it will now inform the adherence counseling section for the client, or to know whether to stop medication if the client is severely non-adherent, or to know why there's a treatment failure later on if there happens to be one. So we have seen the different type of forms that the system generated based on the button that was clicked when you book the appointment for the session. So let's assume that all is well for this client and we have finished. Now, there's another point to note is when you fill in the CD4 and viral load test on the initial assessment for the client, it generates a flag telling us that the next CD4 is due in the next 3 months and the next viral load test is due in the next 6 months. Now, these are just standard times, but we don't do, not every country does testing like that, except in the case of non-adherents or people not on medications. You can reset the date when you come to routine. Let's go there to go to the appointments and patient monitoring, and then you can look at the routine test and reset date here, and then you will see the list of clients who are on the system, who are in care, who has had a CD4 and viral load done. And then if the date is in green, it means that the date for the next CD4 is in the future. If it is in red, it means that the client has not had their CD4 or baseline viral load test done yet. If you need to reset the date, you can take the unique ID here and put it here, select the examination and update, and it will reset the date to be exactly 3 months from the current date, or 6 months for the current date for viral load, 3 months for CD4. And so this is where you can reset date for the different clients. Okay, so the person who is able to do this needs to have routine permissions. And so for supervisors, when you create an account for the users, those who are at the testing site who only do screenings and referral, just need the general population counseling and testing drop down menu. They need the referrals, and they also need updates. For those in the infectious disease clinic, you can give them all permissions apart from the central medical stores and the pharmacy permission. And for those who are super users, they can have all permissions. So you can look at the manual to see the permissions and the functionalities that the person will be able to perform when they are assigned those permissions, and now decide based on the job function of the person what permissions that they need to be assigned when you create the accounts on the live system. Okay, so now we've done the psychosocial support and adherence counseling for Princess, and we want to have appointments for clinical management. And so we'll put in the unique ID, and the reason for appointment is HIV clinical management, and we want the appointment to be today. Now Princess is in the clinic. We want to record the vital signs, so we create visit, and then we enter the temperature. The scenario says that on her first clinical management, she has a temperature is 100, the blood pressure here is 120/80, the pulse here is, we don't have the pulse, we have the heart rate. The respiratory rate we have here is 26. We have the weight of Princess to be 27 pounds. We don't have the height of Princess, but we need that, so let's assume that she is, let's say she's 60 cm, and this will give us in meters, and then the BMI will be calculated once we come here. Let's say her height is, she's 3 years old, let's say she's 45 cm. No, the BMI is too high for what we want. We want her to be malnourished. So if she's 27 pounds, she will not be malnourished. Okay, let's just move on. We don't have anything about the head circumference and the chest circumference and the mid-upper arm circumference for Princess. So we'll just send. So in real life scenario, she's there. You can have all of these values once you take the values there and you record. Now we've done this, and we can come to clinical management. If we look at waiting clients, we have Princess waiting to be seen, and the doctor can now come here to get HIV care card, put in Princess, unique ID, get forms, and we'll find everything here. The trend of CD4s and viral loads will be there. The trend of the BMI is going to be there, and then we have drug resistance test results if there are drug resistance test results recorded, and you can click to view all of the screenings record for Princess, and here gives us the demographic information, the last vital sign that was taken, And the first tab allows you to retake the vital signs if you feel like retaking it. And then we have the pediatric symptom review form that looks at the different symptoms, the developmental assessment. We have also the physical exam and appearance. We also have the next tab that looks at the TB symptom checklist. It is the same symptomatic checklist for all category of clients. We have the pediatric health care card, which is totally different from the health care card for an adult. This just looks at the nutrition of the child, the developmental status at the current visit, if there are opportunistic infections, the health regimen for that child, and then also the reasons for change or stop in the event that the ARV is changed or it is stopped, the hemoglobin level, and the ALT. Then we have the CD4 and viral load. If there are new results at this visit, they can be entered here. The clinical staging for pediatric is also different from that of adults. Most of our symptoms correlate with stage 3, and so you tick what symptoms she has and gives the stages for Princess. Advanced drug reaction to be recorded if she has been on ART and at this visit there is LFT elevation or jaundice or abdominal pain or any drug reaction that the parents have reported. Treatment is where you put in, like we saw before, the treatments that you are giving Princess here. You select that, you choose the category of treatment, the dose, the duration. You can also put the frequency and the routes of administration here, and then initial evaluation information. You will see what was filled in for the initial clinical evaluation. If anything needs to be updated, you update it here. You will find the immunization information. If they were filled in, you find them here. You can update it if you want. Then tuberculosis registration. In the event that Princess has tuberculosis, here is where you register Princess at that visit. And then you look at all the previous symptomatic checklists of Princess if they have been recorded on the system. The diagnosis and category of the tuberculosis infection, this is where you put them in. The TB drug resistance testing, if there is one, you will do it here or record them there. And then the treatment monitoring for the treatment, all the screenings you want to do to monitor the drug side effects on Princess here. And then we have the TB adverse effects and effect management here, and the TB treatment outcome here. And not all of the tabs are necessary for every visit. You use the tabs based on what you want to do, based on your evaluation. Now we have the scenario give us different visits and different things that are done at these different visits. I won't bother to go through it. These are things you can go through and try to fill in everything for pediatric. But we have gone through and we have seen all of the forms for a pediatric case and how they are generated. Does anyone have any question? Okay, is it easy to follow for everyone? I'm not getting a response, so I'm not sure if I should repeat or should go forward.
Go forward.
Okay. So we have seen the pediatric. The process is the same with the adult, only that you use pediatric links instead of adult links. Now let's look at an exposed infant. If I'm not going to go through filling in antenatal again for Dorothy, but we have a history for an exposed infant that is born by the same Dorothy on the scenario, and we want to look at how we register an exposed infant. We will come to care registrations and initial evaluation here, and then we'll look at HIV, syphilis, and hepatitis exposed infant registration. You click on this and you do the registration for the exposed infant here. So let's say 17. So for exposed infants, you do not need to create any account. You don't need to come here to create an account to go through this process. For exposed infants, the first entry point is to come to care registrations and initial evaluation, then select HIV, syphilis, and hepatitis exposed infant registration. It gives you this form, and then you fill this form in. So we know that exposed infants for most countries are registered at the ID clinic, not at the health centers most of the time once the child is born. So the first name of this exposed infant from the scenario is Jason. Let's assume a last name for Jason. The date of birth is today. The mother's unique ID. We have not created an account for Dorothy, but let's assume we have one, and our unique ID was DU. So let's say we have DU, and we have DUM 88F. Mother's maiden name, let's say we have Michael, no, unknown. Infant's ID, so let's give a unique ID to the infant. You can decide how you want to have unique ID for infants. You want to use the pregnancy ID as their unique ID. That will not work, because what if the pregnancy resulted into multiple births, like twins? Then the unique ID will no longer be unique. You need two. So you can actually register birth using pregnancy ID and another suffix. So if they are twins, you can have the pregnancy ID 01, then pregnancy ID 02, and things like that. So we want to do this for this one. Let's assume the pregnancy ID was DUM 88F 02, and then we'll put 01, 02, 01. You'll say DUM 88F 02, 01. And then the health district, we'll just select the parish, the sex, the weight at birth, to say 6 pounds. No, is it 6 pounds?
A question,
Yes.
Mildred.
Yep.
So if they were twins, how
Yeah.
would you distinguish them?
Okay. Some people don't name. Some people name their children before birth. Some people don't even name their children until they leave the hospital. And so you use 01, 02. You just number the children. So you can use the pregnancy ID of the mother and add the number of the child. How to distinguish one twin from the other? Maybe by the name tag they put on the hand of the tags they put on the hand of the infant. I don't know how the hospitals will differentiate that, but just if the child has no name, then there should be a tag of a number that identifies the child. Okay, so we can decide to have a tag on the arm of the child that has this number, that's the number to use.
Okay, thanks.
Okay. So the child is 6 pounds, and the length at birth we said is 45 cm. And we have type of feeding, replacement feed, and what is the infant exposed to? HIV and syphilis. We register. So this child has been registered for care as an exposed infant. And the next thing you want to do is to have psychosocial support, adherence counseling, or just have a clinical management appointment. First of all, we can come here to look at the HIV exposed infant evaluation. So after you register, you do the initial evaluation. Some of the forms for the initial evaluation are the same as that of pediatrics. So the ID was DUM 88F 02 01 and get form. So we have the initial evaluation for this exposed infant. We have the enrollment form, which is similar to that of the pediatric, only that this child too was not exposed to any treatment during the pregnancy, but the scenario said that was given AZT, right? The scenario said that Jason was given after delivery, I think AZT. Okay, and the age at enrollment is still 0. You can put this age in months, you can put it in years, but it's better for an exposed infant to put them in months. Then all of the same information we filled in for pediatric is what you put here. There is no diagnosis for the exposed infant yet, and so you skip all of this mode of transmission and date of final HIV diagnosis and the type of test. you just put in the month of delivery. The gestational age at birth was 39 weeks, and duration of membrane rupture, if you have those information. Then the exposed infant screening, age at test 1, you decide what ages screenings are done for exposed infants within the countries, and you put the age, if it's at 6 weeks, at 6 months, or exactly at birth, you put the age there, the date of the test, the type of test. I think it's always PCR, right?
Yes, it's PCR.
Okay. And then the result of that test, and then you save. When it's time for test 2, you do that, record that until the final test for when the child is the last age of the test there. Then the immunizations, here you record all of the immunizations that are, or the vaccines that are given to the child whenever there is a vaccine given. And once this initial evaluation is done, you can go through the process of adherence counseling for the child and for the child's caregiver, and then select an appointment and then come to clinical management. Let's see whether we can get an appointment here. TUM 88F 0201. The reason for appointment is HIV clinical management, and 17th of October 2024. Schedule appointment. We have the appointment, and then we record vital signs. Start visit. So now we have the vital signs form. Let's just put normal things in normal range. The blood pressure, let's say the pulse is, and the respiratory rate is 26, or let's say 22. The weight is 6 pounds. The length is 45, and then we have the head circumference. From the scenario, we have the head circumference of 33 cm, the chest circumference of 32, and the mid upper arm circumference was not given. We'll save. Now you can come to clinical management and get the care card for DUM 88F 0201 and get forms. Now we have the forms generated, and it's similar to that for a pediatric client. The only reason you have all of these forms here is if this exposed infant becomes positive at some point, then you already have everything generated, and all the initial evaluation information that was filled in during the initial evaluation here, the screening information will be here, and the immunization forms here. If the child has tuberculosis, you can register here, and every other thing. This child is also exposed to syphilis. You can come here, and let's see whether we can get a care card without having to generate one. If we don't have a care card, we can do a syphilis referral and then get the system to generate a syphilis care card. Okay, so we have the syphilis care card for the exposed infant. So you just go to the care card, and because the child was exposed to both HIV and syphilis, we have the care card by coming to clinical management and get other care card, enter the unique ID, and it gives you the form to record congenital syphilis case report for that child and congenital syphilis clinical and diagnostic data, the treatment monitoring, the symptom review form also, and the immunization form also. Okay. Does anyone have any questions about this? Okay.
I think
So
it's just a matter of when you start to use it, you
Yeah.
get accustomed to it.
Okay. Okay, so we have other parts of the system where we have not looked at, which is for the contact tracing. We looked at the case of Bruno yesterday, and we did the contact listing for Bruno. So we have a lot of contacts to work with. When you are doing contact tracing, you should have the prevention control permission, and you will see prevention and control /PMTCT drop down menu here, where you can look at all of the different things that has to do with prevention. You can look at the listed contact list to see the list of all of the contacts that are listed from the antenatal clinics and the ones that are listed from the general population. You have a status column here that tells you if that particular contact has been traced and the report of the tracing, and if it's blank, it means that this contact has not been traced. So you will see once the status is not traced, then you want to look at the report and continue the tracing of that contact. So let's say we want to trace a contact, Lucas Benjamin, that was listed by this unique ID, and so we take the contact code, and that is what we need. When we go for tracing and we return, we want to report tracing here, enter that contact code. Make sure you know where you copied it from, either from the antenatal clinic or from the other population. This was from the other population. We'll paste the code here and report the tracing. Now this gives us the form to fill in the dates of the tracing and then the report of the tracing. Now, if the tracing is not complete, maybe you called or you visited, you didn't find the person, you can put it here, but to not mark as traced. When the person has been traced completely, maybe the person said they're coming in for testing, or the person has come in for testing already, then you can come here to edit mark as traced. So let's say that client was called and he shortly showed up at the clinic. For screening, right? So this client has been screened. We don't need to put anything about the result. And then now you put mark as traced because this is complete. And then we submit. So once this has been submitted and you come back to listed contact, you won't find that has untraced anymore. The status is traced. If you want to filter this, you can either click on the column to filter, or you can come to unlisted contact list. Let's go back to that. Untraced contact list here, and then you will see people who have not been marked as traced, and the ones who are marked as traced is not going to show up on the list. So to make it easier for you to know which contacts you are filling in. So this way you have the list of all of the contacts that are listed, and then you can report and everyone will see that tracing is complete for that contact, or whatever the report is if the tracing was not successful. Does anyone have a question about this? So if you look through the different functionalities for prevention control, the person who is assigned that permission can look at the risk behaviors of any client, can fill in a risk reduction plan, can look at all the risk reduction plan history that was filled in, can look at all of the contacts that have been listed for both antenatal clinic and for the other population, and can report tracing, can also look at all of the people who are referred for pre-exposure and post-exposure prophylaxis, and also look at the list of contacts whose tracing has not been concluded, and then also can look at all of the pregnant clients that are registered for PMTCT and look at all of the PMTCT registration history for a client. Does anyone have a question? Okay, so we have covered all of the agenda and the functionalities for screenings and management, part of the system, and we still have time left. I don't know if anybody wants to share screen and practice with guidance, or you want to practice privately and send a message if you feel stuck. We still have time, so if you want to have screen share and go through, you are welcome to do that. Anybody? All right, in the absence of that, if there is no question, you can keep practicing using the scenario and send me an email if you have issues. We will meet again next week for the final 2 days where we do a review of everything and the final practice and assessment for master trainers also, and look at the surveillance report. So thank you everyone. The recordings for this week's trainings will be uploaded as soon as possible, so you can look at all of the recordings from Monday if you need further or you want to refresh all of what we have done. All right. So thank you, everyone, and see you all next week.
Thank you.
Thank you.
Thank you.